Would you like to answer
yes.
that?
It is, yes, madam. It is really difficult as of now, with due respects to all the specialities, right from the resective person to the reconstructive person to the rehabilitative person. The incidence is quite low as of now. That's where we need to build the consensus. Probably it is going to take a while before the combination comes in, because India is a vast country. The training is at different levels. The economic levels are at different levels, because right now, initially, it was purely a curative intent.
Yes.
Then came the reconstructive intent. Now, slowly, the rehabilitative intent is also coming in the picture. So, when all the three things can be considered, as well as the insurance comes in, because economically also, as you move from the curative intent to the reconstruction to the rehabilitation, the finances involved are also going to increase. So, and as insurance comes in, or a lot of schemes are coming in government schemes are coming in the medical area. So probably yes, the rehabilitative person, and awareness from not only from the medical field, from the patient side also, if at all they are increasing, then probably yes, all the three can be combined and working together.
One more question. Are you counseling the patient before you set on to your surgery?
Yes, in my setup, yes.
Only last week we had 2 cases, and this patient was a young patient, about 42, and she said, I didn't want to go in for this surgery if it's going to cause disfigurement. She told the surgeon straight away, and she was attempting suicide. And there's one more person, she is about 54, and her son comes and tells me, like, I don't want to disfigure my mother's face. So this is a big challenge in front of the surgeons, that they work as a team.
So I'll address both your first point and the second point also once again. Traditionally we've all been looking at patients not as a whole,
Yes.
apart from the body, the mind, and all the other socio-economic areas completely included. The moment you look into that, then yes, these questions arise. And where the counseling, before they get into a major surgery, the counseling becomes very important. That he has right to know what is the disfigurement which is going to be caused and how it is going to be rehabilitated. They all have to be discussed at the same time. So that is, I suppose, answers your second question. The first question that you talked about, do people still recommend them all the options or no? What we are discussing here right now is as probably people who are associated with the technology, and Shibu playing a role to bring all of us together. But the moment the hospitals start thinking that these are the questions which are raised by the patients, the hospital will have to set up a small area where they can also work on. See, that's the area where the resources will be. They will have to set up a technology center where they will have to have, people who are associated with the technology and set up, because they will be able to set up these centers, which we right now as individuals are working. And the moment the hospitals start offering those services, it becomes a much better point, because the doctors normally, when they see the patient is in a hurry to get things operated. It is only maybe 10 or 15 or 20% of the people will ask you so many questions. Yeah. Others, they think that, okay, this is what they have to go through. So they're looking at. Now, the moment that becomes, the hospital will be compelled also to set up a technology center which will house all these things, and then it becomes much more easier for these services to be offered in a time-bound manner or much faster than what otherwise. Otherwise, the doctor has to scout for who will do this or who will do that. If they have a center there themselves who is kind of completely empowered to discuss everything and get everything sorted out in shortest possible time, it will become a reality.
I'd just like to add, rather than say it's a relevant question whether surgeons are involving prosthodontists, I would turn the question around to ourselves. How many prosthodontists are actually willing to offer their services for head and neck prosthetics? So I think it's whenever you shake hands, I think both parties have to come come forward equally. So I think we as prosthodontists also have to understand that we should be ready to offer our services to the surgeons. There has been a survey in the British Journal of Oral Maxillofacial Surgery where it's clearly suggested that a lot of reconstructive surgeons resorted to surgical reconstruction simply because they did not have a prosthodontist in the vicinity to be able to who could offer their services. So I think it works both ways.
Well, to add to Dr. Srinivasan, what he said, like, it's a matter of training with the postgraduates, how much of maxillofacial prosthodontics they are doing, and how much they can offer, because it is a completely different kind of mindset that you need to have to visualize and everything, which not many people are having. I'm happy to see that Dr. Srinivas does a lot of things. But I'll tell you from what I had seen, that most of the oral surgeons who worked with me, they were only happy in cutting away the cause, and not thinking about the rehabilitation. I think they should the first ones to, come out with this dimension. Okay, because they should understand that it's a unique thing. Oral surgery is unique because we have to come across the teeth, the occlusion and everything, which maybe the oncosurgeons on the other side, the head neck, may not be able to visualize that. So very few oral surgeons are into this head neck surgery, but most of the doctors that I come across, the surgeons, they are more in the ENT, the general surgery, who have got fellowship into oncosurgery and all that. So there is that barrier over there. So I hope you would propagate this of involving prosthodontists everywhere. Thank you.
Yeah, please go ahead.
Hi, my name is Dinesh. I represent a company called Printform. We're based out of Atlanta. We do a lot of work on metal, and we talk as passionately as you guys talk with regards to selection of material for automobiles and for any other aerospace issue. My question is, what's the regulatory framework? What's the thought process which goes into when you all select material? There were enough slides. We heard titanium, we heard all that. So what's the regulatory framework? What's the thought process? Is there always, like in the metals, in the automobile and aerospace, where new materials we are talking of, we are developing? From a medical field, how do you all address that? When options are limited, I know we've heard everything, right? From skin to titanium to cobalt to, starting from aluminum. But just some inputs will help.
I'll take that question. The regulatory framework as far as biomaterials in India goes is in a fluid state at the moment. The reason is that all biomedical devices were not under any regulation for quite some time until the famous stent case at JJ Hospital happened. And then suddenly now we have a list that is classified as a drug. So the unfortunate part of most, at least the bone reconstructive materials that we work with, is that they come under a category that is actually regulated by the Indian regulatory system, which unfortunately is ill-equipped to understand materials which are not of a drug nature. Therefore, we are in the curious situation, unfortunate situation to be more precise, where it is regulated but nobody knows how the regulation works. So the trick is to, if you really want to do something, is to use materials which are already approved in their native pure form, or as pure as you can get them, because you always fiddle around a bit with materials to make them printable in using whichever technology you use, and then or use pre-certified materials which come under CE or USFDA or other similar markings. So therefore, that is the safe way out, because they've already been regulated, and then the regulation system is weak here, so you just start using them. For newer materials, the situation is absolutely fluid, and nobody wishes to bite the bullet. That's the situation. But those who are using well-known materials, there's no issue there, as the various cases you've seen here today.